Okay, so it is 11:30. We can go ahead and get started. Welcome everyone to Security Health Plan Academy. And you probably already heard this, but just to reiterate a couple of notes here before we get started. We do ask that any questions you might have, you save them for the end and you can submit them using that chat feature here in Zoom that Ryan just mentioned. We will have Ryan address them after his presentation. After today's presentation, we will also send a follow-up email with a link to the recording of today's webinar, as well as other helpful links about today's topic. And that email will also include all of the questions and answers that you asked today, or any that were submitted to us via email prior to the webinar. So without further ado, I'm going to formally introduce Ryan. He is a learning analyst here at Security Health Plan. Ryan has worked in the health insurance industry for 7 years. His experience varies from customer service to sales, and in his current role now in our training department. So Ryan, thank you for joining us today, and I'm going to turn it over to you.
All right, thanks, Kristen. So today we're going to talk a little bit about health insurance basics. Some of these things will be broader topics across all of health insurance. Some of them are going to be specific to Medicare. Towards the end, we'll talk a little bit about some benefits specifically to our Medicare plans. We'll talk about some things that kind of bounce back and forth. So what we're going to go over today is getting started, like how do we get coverage? We're going to talk about what type of costs are associated, who do I have to pay and what types of things. We're going to talk about providers and where to get services, perks, what benefits do I get on top of just, deductibles and copays and things like that. And then we'll talk about securityhealth.org. There's a member portal, and we'll talk a little bit about the app for your phone and the different things that you can do there. So getting started, talking about Medicare coverage specifically here, people become eligible for Medicare usually when they turn 65 or when they're granted disability Social Security. So most people, it's when they're turning 65, the month of their birthday, they have this initial enrollment period. And so this is 3 months before the month they're eligible, the month of their birthday or disability, and then the 3 months afterwards. So they have this 7-month initial enrollment period. But even besides that first enrollment period, every year from October 15th through December 7th is the annual enrollment period. So that's where people could add or drop or change or switch or do whatever you want to do. So we just got out of that a little bit ago, but so even if you don't have anything else going on, every year you can make a plan change at least once a year. Taking a step back out of Medicare, there's also, if you're on the Affordable Care Act, the ACA, like healthcare.gov, there's also an annual enrollment period there, but the dates are a little bit different, November 1st through January 15th. But still every year a chance to make a change if you had a change in your situation, if you are using more services or fewer or something like that. There's also special enrollment periods. So that's, if something happens outside of the annual enrollment period and you need to make a change in March or in June or something like that, then there's this special enrollment period. And there's a whole variety of them. Maybe you're moving in or out of a service area. You're moving from Wisconsin down to Florida. That's a special enrollment period, so you can change plans to something based in Florida. Or if you are losing coverage because you're going from employer coverage to the Affordable Care Act or to Medicare or something like that. So the special enrollment periods vary a little bit based off of what plan you're on. Like Medicare plans have some different ones compared to commercial plans or employer plans. So, but in general, there are special enrollment periods on every type of coverage. And then again, specific to Medicare, there's the Medicare Advantage open enrollment period. And sometimes that verbiage is confusing, the annual enrollment period and the open enrollment period. But the open enrollment period is right now, January 1st through March 31st. And that allows you to change to a similar plan or to go back to original Medicare. So a similar plan, you can go from Medicare Advantage to Medicare Advantage. You can go from a Part D plan, like a drug coverage, to a different drug coverage, or you could go from either of those back to original Medicare. So this one's much less utilized than the annual enrollment period, where a lot of people change or add or drop or switch. This one is mostly used for, if you enrolled in something and you didn't fully understand it, or you were misled and you didn't get all the details, something like that, you can use this period to switch back to where you were, or to switch to something that better fits your needs. So usually this is a little less busy than the annual enrollment period, but still a chance to make plan changes. So what types of costs are associated with health insurance? Well, there's two main categories of cost. One is premium, and one is out-of-pocket costs. And these kind of balance out. Like if you think of scales, usually if you have a lower monthly premium, you have higher out-of-pocket costs. Or if you have a higher monthly premium, then you have lower out-of-pocket costs. So the costs that fall under your out-of-pocket costs would be things like deductible, co-pay or co-payments, co-insurance, and those things all fall out of your out-of-pocket costs, and we'll talk about each of those. And then we'll also talk a little bit about not covered services or denied services as well. So what is premium? Premium is the monthly cost of having insurance. How much do you pay to have the insurance? Some plans are as low as $0 per month. You don't pay anything to have the coverage, but then keep in mind that balance on the lower premium plans, usually you'll have higher out-of-pocket costs. So a lot of people say, well, that zero plan is the best because I don't want to pay anything. Well, if you know that you're going to be using a lot of services, if you are a diabetic and you have heart problems and things like that, you know that you're probably going to go in for several eye exams per year and quarterly lab work, and you're going to get your A1C checked and your heart cholesterol and things like that. So maybe if you know that you're going to have 8 to 10 visits this year, maybe look at a plan with a slightly higher premium that gives you slightly better coverage. So always kind of weigh out how much are you paying per month versus how much are you paying when you have services. And some of the time, the plans that have a much higher premium are going to be more cost effective for you. Even though you're paying a lot upfront, you're going to be paying quite a bit less when you're going in for services. So it's always that balance of more upfront and less later, or less upfront and more later. And sometimes you have to run the numbers, and sometimes your situation changes. You might have a couple of really good years and you can be on a zero plan, or you might have a couple of rough years and maybe you want to be on a higher premium plan. So the premium is how much you pay each month to the insurance company to have coverage. The other costs that we talked about are the out-of-pocket costs. So these are the things that you pay to the providers in order to get services. Whenever you're receiving services, they usually accumulate somehow into out-of-pocket costs. So the first term is deductible. So on a lot of plans, deductible is a phase where you're paying 100% of the cost of services. Not 100% of the billed amount. Like sometimes the provider will send a bill for $250 and we'll discount that down to $180 or something like that. We've got these contractual agreements and discounted rates and things like that. So we say, well, for these services, we're going to pay you 70% of the cost rather than 100%. But during the deductible phase, you'd pay 100% of the discounted amount. So if the bill was discounted down to 180, you'd pay $180. So whenever something goes towards your deductible, it's going towards some number where you're paying 100% until you reach that number. So on a lot of commercial plans, like employer plans or through the Affordable Care Act, you might have a $2,000 deductible. So you're paying 100% of the cost of services up until that $2,000 is met. And then after that, something else happens. So some of the time you have co-payments after the deductible. Again, $2,000 deductible, and then after that you pay co-payments. And a co-payment is a set amount for a specific service. A $50 copay for a specialist office visit, a $200 copay for emergency room or for ambulance or something like that. And regardless of how much the bill is, whether it's $170 or $1,000, you're only going to pay that set amount. Now, sometimes copays happen after deductible, or sometimes they'll happen at the same time as the deductible. So for instance, on a commercial plan, again, you might have a $2,000 deductible. For medical services, when I go to the doctor, when I go to the emergency room or something like that, But I might have co-payments for the pharmacy for my prescriptions. Maybe for a tier 1, a generic, I might have a $10 copay. So I'm going to pay $10 regardless of the cost of that medication, unless the total is less, then I pay the less amount. But I might have $10 for tier 1 and $30 copay for tier 2 and a $50 copay for tier 3. So I'm paying those co-payments alongside my deductible, or maybe I pay those after I meet my deductible. Plans could go both ways. But those both count towards my out-of-pocket maximum for the year, my annual out-of-pocket maximum, or it has a couple different names, but maximum out-of-pocket cost for the year. The last one is co-insurance. So a co-payment, a copay is a set amount, where a co-insurance is a percentage amount. So usually it's a 20% cost or a 30% cost or 40. Those are pretty common co-insurance. So during the deductible phase, I'm paying 100% of the cost until $2,000. And then I'm paying 20% of the cost from 2,000 up until 4,000, for example. So at that point, I'm paying 20 and the insurance company is paying 80 percent. So usually you have an annual max out of pocket or out of pocket maximum, whatever it's called. And so you'll pay some amount of deductible, co-payments, and co-insurance until that out of pocket max is met. And so some of the time your co-insurance might be that whole other $2,000. I paid deductible for $2,000 and then I pay co-insurance for $2,000. Some of the time I might have a lot of co-payments. Let's say I got pharmacy for 10 months and I'm on 5 or 6 different prescriptions. Sometimes that adds up to the $2,000. But usually all of your deductible, co-payments, and co-insurance will stop and you'll get coverage at 100% after you meet your annual out-of-pocket maximum or maximum out-of-pocket or something like that. So some of the time you have not covered services or denied services. And so there's 2 types of ways for services to be denied. Some of the time we deny services back to providers. We'll talk about providers on the next slide here, but some of the time the claims that were submitted to us aren't submitted correctly. They have the wrong CPT codes, or they have the wrong modifiers or location, whatever it might be. And legally, we can't pay those claims. That's considered insurance fraud if we pay these claims and we just say, nah, close enough. I get the idea. We have to have these claims very accurate. And so we have to deny it back to the provider, and they can't bill you for that until they fix the claim. They have to submit it the right way and have the right codes and modifiers and all that stuff. And then once we process it, then they can bill you for that. So some of the time we deny a claim, but it's not your responsibility. They need to fix their stuff first. But some of the time we deny claims because they're not a covered service or because they're specifically listed as an exclusion. So every year you get this evidence of coverage, and it's this big, and it lists every service that you can have or every type of service, and if it's covered at 100%, if it's covered subject to your benefits like deductible, copay, coinsurance, or if it's a listed exclusion. On this plan, gastric bypass is not covered, something like that. But otherwise, if it doesn't clearly say these things are covered always, these things are not covered always, sometimes there's this gray area in between where services could sometimes be covered or sometimes not. So I used to work in customer service, like she mentioned, and like a mole removal was always a really sticky gray area, because a mole removal could be medically necessary. If I have this mole and they do a biopsy and it's cancerous or infectious or something like that, then sometimes it is medically necessary and it's going to be covered for that mole to be removed. But some of the time I have a mole and it's just a big ugly mole on the back of my hand, and it's not harmful. It's not risking my health, but I just don't want it to be there. And if I had that removed, that would be a cosmetic procedure. So the same service, mole removal, could be medically necessary and covered subject to your benefits, or it could be cosmetic and denied to you, and you'd pay 100% of the cost. So this is why I would encourage you, if you're ever going in for things, call ahead of time. Call our customer service. They do a great job. They're really knowledgeable. They're super friendly. if you call and say, hey, next week I'm going to go into this doctor, I'm going to have this, procedure done or whatever, it's always better to get the details ahead of time than to find out afterwards, oh, that's not a covered service. Now I have to pay for that. That doesn't go towards my annual maximum. It doesn't, fulfill my deductible or anything like that. I'm just paid out of my pocket for that. So always call ahead of time and get the heads up, and maybe you could adjust it or and make sure you're doing this or talking that way or whatever. The more information you can have ahead of time, the fewer surprises you'll have after. So I've mentioned providers a few times. What are providers? Providers are either doctors, like the physicians doing the actual procedure, the overview, the office visit, whatever it might be, the physicians themselves. And providers also means the facilities where those things happen. So usually when you go in for services, it's pretty common to get a claim from the doctor, from the physician, the provider doing the service, holding the scalpel and removing the mole. But there's also pretty common to get a claim from the facility, from the location, the surgery center, the clinic, or the hospital emergency room, for the stuff that was used there. Well, we use this much gauze and we use that much oxygen and we had the machinery for this and that. And so you get a bill from the doctor performing it and from the location of where it was performed. So both of those are called providers, the physical person and the physical building. So for instance, a provider network would be like the Marshfield Clinic Health System. And within the system, there are the doctor providers, the physicians, but there's also the different locations. There's Marshfield and Stevens Point and Wausau and the different buildings there. So provider could refer to either of those things. And And there's in-network providers, or sometimes called affiliated providers, and there's out-of-network providers, or sometimes non-participating providers. And it's usually better to go to in-network providers because we have a little bit more sway with them. Again, we have contractual agreements and we can encourage or enforce specific things. Usually out of network, you're going to pay higher costs. You're not going to get as many discounts. But specifically with our Medicare Advantage plans, for a couple of years now, your co-payments and your maximum out of pocket would be the same whether you went in or out of network. So an office visit with a specialist would be $50 at the Marshfield Clinic here in Marshfield, or if you went to some random doctor in Florida. But again, if you're going in for a service that requires prior authorization, in network, we can say that provider has to do the prior authorization for you so that you guys don't have to do the work to do that. In Florida, we could say, hey, I'd like you to do the prior authorization. They'd say, well, I don't care. I'm not going to do that for you. And we can't enforce or encourage them in any way. So it's not entirely the same where you go, but the cost is going to be entirely the same. You'd pay the same in or out of network on our Medicare Advantage plans. Also on our Medicare plans, original Medicare doesn't cover much in the terms of glasses, hearing aids, dental, anything like that. And so on our Medicare Advantage plans, we have extra benefits besides just copay and deductible and whatever else. We have a vision stipend. So we have one eye exam covered at 100% per year, but we also give you $175 or $235, depending on your plan, towards a pair of glasses. Same thing with hearing aids. I guess those are outrageous too, $2,000 to $10,000 per hearing aid. So on our plans, you would pay $500 per hearing aid per ear per calendar year. And for people that need hearing aids, it's hard to distinguish per ear per calendar year. But yeah, so you'd pay $500 per hearing aid for up to 2 per calendar year. And dental, I know that we have one cleaning, x-ray, and exam covered at 100% each year. And you can get additional dental coverage for root canals and emergency treatment of pain and different dental work as well. So the extra dental work comes with an extra premium, but otherwise built into the plans, you get one free cleaning, x-ray, and exam covered at 100%. Just some rapid fire other perks that you get $30 per quarter for over-the-counter benefits. So again, things like calcium or multivitamins or Band-Aids or toothbrushes, whatever it is, every quarter you'd get $30, and that's mail ordered delivered right to your house. Free meals if you have a history of congestive heart failure and you're getting out of a hospital, something like that. Free health coaching, care management, disease management. So if you have COPD or diabetes, or if you have a knee replacement, or if you're getting discharged from the hospital, we have care teams here that can help to make sure that you're staying well and not going back into the hospital. Silver Sneakers membership. I actually used to teach Silver Sneakers in my younger days and do some stretching and strength training, and it really helps to reduce falls and risks and things like that. So you get a membership at no cost. You have Care My Way visits. If you just want to call on the phone and say, hey, is this bad? Should I go in for this? No, it's not. All right, here you go. So Care My Way on 24-hour nurse line. I have 2 young kids, and so I use that stuff all the time, like ear infections and whatever else. So these are all included on our Medicare Advantage plans and some of our other plans as well, for like the $30 over-the-counter benefit. Those are on most of our plans. So lastly, I want to talk to you about our member portal. If you go on to securityhealth.org, you can log in as a member and you have all these extra things. Like, I'm the subscriber in my family. I'm the main person on the plan. And so I use this stuff all the time. I check the status of claims. Is this finalized? Is it still pending? I can see if a doctor is in network or not. I can see how close I am to my annual maximum for the year on my family plan, on my individual plan, either one. And recently we added an online chat. So if you don't want to sit on hold, if you don't want to talk to somebody in real life, you can chat questions to our customer service department, and then you just wait around for a couple of minutes. They'll look at it behind the scenes and then shoot you an answer. Hey, can I go to this doctor? Hey, can I have a colonoscopy? What tier is this prescription? Is lisinopril in your formulary? Whatever it might be, you can chat them a couple of quick questions and they'll just chat you the answer right back and you go, hey, thanks. And you can view documents. So I know I've heard this many a times that we have to send a lot of stuff in the mail. And according to CMS and Medicare and all these agencies, we have to send you all that stuff in the mail. So you could sign up for online statements, and you can only get stuff online if you prefer to do that and half as much stuff in your mailbox. But otherwise, if you got something in the mail and you lost it, or your kids ate it or dog ate it or whatever, then you can go online and you can view old statements or previous statements online too. So I personally use this stuff quite a bit, and it's pretty convenient. So how do I get it? If you go on to securityhealth.org, there's that blurb there that says, you can sign in if you already have an account. Otherwise, you can click register down at the bottom. You are going to need probably your ID card, and it'll ask you your first name, last name, date of birth, and subscriber number. Oh, excuse me. Oh, excuse me. First name, last name, date of birth, and subscriber number. And then you'll have to verify either by text message, by the last 4 of your social security. You can get an email, or you can get a physical letter in the mail, but you'll have to verify that you are that person somehow. But then after that, then that's it. You just have your username and password and you log in and you can get access to all that extra information. We also have an app. You can download it from the Google Play or from the App Store, and you can get access to all that stuff online as well. All right. Do we have any questions? I saw a few things fly through the chat here.
I have a question. If right now I'm 64, I'll be turning 65 in August, and I have the Security Health app. Is that app still going to be good once I get on an Advantage plan, or do I have to start over?
Yeah, so you can use the same account. The information on there will change, but once you have a new plan with us, it'll update for your providers and your max out of pocket for the year and that type of stuff. So once you actually enroll in a new plan with us, that will update all the information behind the scenes, and you can log in the same way that you do now, but just the information will be updated.
Thank you.
That was a great question.
That's a fantastic question. As far as turning 65, keep in mind you have the 3 months before your birthday in order to enroll for the first of the month of your birthday. And if you enroll in your birthday month or after, it'll be for a later date, and that potentially leads to a gap in coverage. So I'd encourage you in the 3 months before your birthday to get that stuff straightened away.
Okay, I have a few here in the chat. The chat keeps like glitching up and down. Like I see chats and then they're disappearing. So I'm not sure where they're going.
I thought that was just me, so I'm glad that is also you. But there was a different question about effective date or
Yeah,
enrollment period or something.
Yeah, and it's gone. I don't know what happened. So whomever asked that, if you want to put it back in there.
It said something like, if I missed my enrollment period. So I don't know exactly, so I'll talk in general until it comes back. But every year you have the annual enrollment period, and then potentially you have, okay, thank you. So potentially you have the special enrollment periods as well. So depending on your situation and what plan you're on, sometimes there's, like if on employer coverage, if you are getting married or divorced or having a baby, then there's a special enrollment period to change your coverage, to add a person, remove them, something like that. With Medicare, there's special enrollment periods for gaining Medicaid coverage or losing employer coverage, moving in or out of a service area. So hopefully the special enrollment periods line up with the changes in your life. But otherwise, if you don't have anything going on, then there's the annual enrollment period from October 15th through December 7th every year. There's also in Wisconsin, we have Wisconsin Senior Care that's can help to finagle some coverage once in a while, because that gives you the chance to add or drop a plan once per year. So you could sign up for that for $30 a year and then use that as a special enrollment period, but that's getting kind of into the weeds here. So if you feel like you need to make a change, you can call our customer service department and they'd be able to say, here's a list of 5 common things. Did you hit any of these? Or something like that.
Well, we're right about at the top of the hour, so that was excellent timing, Ryan. If anyone has any additional questions, go ahead and email them to us in the link that was sent with the invitation to the webinar today. Or if you go to the website for our Security Health Plan Academy, there's a link there where you can submit questions as well. And we will definitely include those in our follow-up email, which will be sent out within the next couple of weeks here before the end of the month. So Ryan, thank you again. We appreciate your time and expertise, and be well, everybody.
Thanks, everyone. Appreciate your time today.
Thank you.